This is Susie. Susie decides to get a tattoo. Like many of us, she is a broke college student, so she chooses to get the cheapest tattoo artist she can find. Little does Susie know, the tattoo parlor uses recycled needles. Susie actually got a quality 2-for-1 deal that day. A new flashy tattoo, along with HCV. Susie contracted the hepatitis C virus. The hepatitis C virus is an infectious agent that contains a single-stranded RNA inside a polyhedral capsid core. The HCV structure contains two envelopes. The fatty envelope surrounds the spherical protein envelope. There are also two envelope proteins, E1 and E2. These aid in attachment to the host cell. The virus can range in size from 30 to 38 nanometers. HCV is transmitted when the blood of an infected person enters a non-infected person. The most common route of transmission is the use of injectable drugs. Other routes of spreading include accidental needle sticks, unregulated tattooing, sexual contact with an infected person, and receiving a blood transfusion or organs that are contaminated with the virus. People at high risk of contracting hepatitis C are those having unprotected sex, injectable drug users, and healthcare professionals that deal with needles. A fetus can also obtain the virus from its mother if she has the virus as well. A reservoir for HCV before entering its host is human blood. For the pathogen to infect its host, it must first enter via blood-on-blood contact with another infected host or transmittance of other bodily fluids through a breakage in their mucous membrane. The virus travels through the bloodstream to the liver, where its E1 and E2 envelope proteins bind to the CD81 protein in the hepatocytes and B lymphocytes. These are believed to function as the cellular receptors to the virus. In order to avoid immediate destruction, the HCV virus undergoes a rapid and immediate replication before the body's immune system notices a foreign material. It then mutates so antibodies cannot mark the cells for destruction. Liver cells that are infected with the hepatitis C virus release signals that tell the immune cells to come to the liver. Once these liver cells are destroyed, the liver is damaged, resulting in scarring of the tissue that will increase in surface area over time. Chronically, cirrhosis or liver cancer can develop in the host. The pathogen exits through the host's bodily fluids, saliva excluded, and is transmitted onto the next host either through unprotected sex or any form of blood-on-blood contact. Symptoms of acute cases of HCV normally occur within 2 to 12 weeks after exposure to the virus. However, not everyone with the virus will experience symptoms. Around 80% of acute cases eventually develop into a chronic infection. About 15 to 20% of people can rid themselves of the disease without any intervention. Most cases of acute HCV experience a mild fever, anorexia, and body aches. Only some patients experience jaundice. Chronic HCV can be without symptoms for a couple of decades. Therefore, HCV is most likely not recognized until symptoms of liver disease appear. HCV leads to intense inflammation of the liver. Cirrhosis, cancer, or liver failure can also occur. The majority of chronic liver disease patients are associated with HCV. Diagnostic tests for HCV infections are divided into serologic assays for antibodies and molecular tests for viral particles. Screening assays based on antibody detection have markedly reduced the risk of transfusion-related infection. The primary serologic screening assay for HCV infection is the enzyme immunoassay. The recombinant immunoblot assay has been used to confirm positive enzyme immunoassays. Viral genotyping helps predict the outcome of therapy and influences the choice of the therapeutic regimen. Hepatitis C can be a lifelong infection if not treated. It was not curable in the past, but the treatment options are evolving quickly. Over 90% of people infected with HCV can be cured if treated properly. There are multiple genotypes of HCV that can be contracted, with genotype 1 being the most common. Combination drugs are often used to give the best treatment results. The prescriber will determine what combination of drugs is most effective for the individual patient's circumstances based on the HCV genotype, liver damage, and other medications that the patient is taking. Susie has genotype 1 HCV. An example of a prescription for a combination drug that she could receive is litipisphere and sivosavir, commonly referred to as Harvoni. The drug is a fixed-dose medication that provides an effective treatment while only taking one pill daily. Each tablet contains 90 milligrams of ledipasvir and 400 milligrams of sivosbuvir. Treatment time is a 12-week period. The drug is a direct-acting antiviral medication that inhibits proteins used in viral replication. Although hepatitis C can be cured, there is no vaccine available for it yet. Common methods of prevention include a hepatitis B vaccine, safe injection practices, screening of blood and organ donors, and avoidance of common risk factors. And now it's time for one of Susie's fun facts. Did you know if the hepatitis C virus was the size of a regular basketball, then a liver cell it may infect would be almost 2 times the height of Mount Everest? That's almost 15,000 meters! Now that Susie has been cured of hepatitis C, she can confidently say, "Hepatitis see you later."